Subscribe to our YouTube channel to become a part of our growing YouTube community and to learn English effectively.
Hi. I was wondering if I could get my test results from the other day.
Yes, I would like to schedule an appointment for you to come in and talk with me.
Is something wrong with me?
No, sometimes the test results aren't clear and we need to do more to get a clearer picture.
Can we talk about it now?
I would if I knew anything for sure, but I want to take a second look.
When can I come and see you?
You can come in this afternoon. If you would feel better, bring your husband with you.
Now I know that something bad is up.
Just relax. We will talk about it this afternoon.
What's the matter with me, doctor? I feel so tired these days.
It's your blood pressure, I'm afraid. It's far too high.
And what's the cause of that?
Overwork amongst other things. You can't work 24 hours a day. You've got to slow down.
But I can't just slow down.
You've got to, I'm afraid. And look at this. You weigh 200 stones. That's too much for a man of your size.
You mean I've got to lose weight?
Yes. You've got to cut down on bread and potatoes and take more exercise.
Good morning, doctor. I've been suffering very much from a toothache lately.
Well, let me have a look. Will you sit down in this chair and open your mouth wide?
I think one of the back ones at the top is giving me the most trouble.
Yes. This big one is badly decayed. I'm afraid it must be taken out.
Oh, I hate having teeth pulled out. Will it hurt?
No need to worry. You won't feel anything at all. I'll give you an injection to stop the pain. Just wash your mouth out with this water, will you?
Will it take long?
No, it'll be over soon. Nurse, get some X-rays of our patient's molars. Then we'll start. Open your mouth wide. Don't be so nervous. Now open wider. Now stay. That's over.
Is it out?
Not yet, but it soon will be. Now open again please. It's out. Look.
Well, really, that was wonderful. I felt no pain at all. Thank you, doctor. What is your temperature now?
My temperature is 39 degrees centigrade.
How high was your temperature yesterday?
I didn't take my temperature but I felt feverish.
Will you open your mouth? Your throat is swollen.
Doctor, I can't eat any foods because I had a sore throat.
You seem to have a cold. I'll give you an injection and let me write down your prescription. What's wrong with you?
My head hurts badly.
How long has it been like this?
Since last night.
Do you have a sleeping problem?
Yes, I even can't fall asleep these days.
I think you'd better have a further exam, and before the result comes out, try to relax yourself and take the medicine before you sleep. It will help you to kill the pain and make you sleep well.
Is it serious, doctor?
When the result comes out, I will tell you about it. Remember, never be afraid or be too tired.
Okay, thank you, doctor.
What am I supposed to do with this plastic cup?
That cup is for a urine sample.
How, exactly, does this work?
This particular test calls for you to urinate into the cup after you have urinated a little into the toilet.
When I finish, what should I do then?
You need to leave the cup in the cubby in the restroom, and the lab tech will get it from the other side.
What is my doctor testing me for?
If there are bacteria in your urine, it could mean an infection somewhere.
Will I know the results right away?
Your doctor will be contacting you with the results.
Good afternoon, madam. How can I help you?
Well, I am a little bit out of shape. I think I should get some exercise to keep fit. What kind of service do you offer?
First of all, we'll tailor a workout plan according to your physical conditions and your personal needs.
How can you get that done?
Well, we give each of our customers a qualified personal trainer. The trainer will give you a fitness assessment and then come up with the workout plan.
What else?
Since everyone is different, your personal trainer will help you find out all the exercise equipments that are suitable for your fitness level. Then you'll be taught all the necessary techniques to us.
Sounds pretty good. How much do you charge?
That depends. We offer membership for 1 month, half a year and 1 year.
Perhaps 1 month. I'll just have a try at first.
Wise decision. That is 400 yuan. You'll find it's totally worth it.
Okay, I'll take it.
Is there a medication you can prescribe to help me with my problem?
There are various choices of blood pressure medication that we can try.
What is available?
We could start with hydrochlorothiazide, which is a diuretic.
Are there many side effects?
There really are not many side effects. You need to drink a lot of water when you take this pill.
Is that the only medication I need to take?
It might be, but for a while I also want you to take an ACE inhibitor, lisinopril.
What are the side effects of that drug?
You may have a little bit of a dry cough, but you will feel much better.
You're looking rather pale. Why?
I couldn't sleep well recently.
You'd get plenty of sleep for you work so hard.
I always drink too much wine in the evening.
You shan't drink more wine in the evening.
Yes, you are right.
And you'd take some exercise every day.
Many thanks for your advice.
Please point out the painful place with your finger. Is there any relation between the pain and the weather?
Yes, the pain comes more intense when the weather is bad. And the pain comes intense when I walk too much.
Have you ever had any trauma?
Yes, I have.
Does the pain become more intense at night?
Yes, T does. Just like a needle prick. Besides, the place that hurts often feels cold, too.
Do you have the sensation of ants crawling over the painful part?
Yes, I do.
I'd like to treat you with acupuncture if you agree.
By the way, does acupuncture hurt?
Acupuncture may cause just a little pain, but it also causes a certain feeling of numbness and distension. We'll try it every day for 7 days. Will that be all right?
Yes. Let's start today.
Hi, may I speak to Ryan, please?
This is Ryan you are speaking with. What can I do for you?
Hi, Ryan, this is Malia, and I will not be coming to work today.
What is wrong with you?
I have really bad poison oak and can't stop itching.
How long have you had it?
I've had it a few days, but the rash really got bad last night.
How have you been treating it?
I have some lotion that the doctor gave me, as well as an antihistamine.
That should work. I'll see you tomorrow when you return to work.
Well, good morning, Tom. I haven't seen you for a long time.
I'd been feeling pretty well until just a few days ago.
What seems to be the trouble now?
I feel run down, tired. I've been having headaches almost every day. And I'm not getting as much sleep as usually do.
Have you been eating properly? Eating the right kind of food is important for your health, you know.
Well, I haven't been eating well, I guess. I usually only have enough time to grab a sandwich and a cup of coffee for lunch.
And what about dinner?
Sometimes I'm too tired to eat anything at all.
That's not good. You don't have a well-balanced diet. Have you been taking vitamin pills?
I don't like to take any medicine at all without talking it over with a doctor first. Dr. Lin's office.
I need to make an appointment to see the doctor.
How about 2 o'clock this afternoon?
Good, but can you tell me how to get to your office?
What's wrong with you? You look pale.
I'm not sure. I feel hot and cold.
When did the trouble start?
I was sick most of the night.
It sounds like you are coming down with the flu. Let me take your temperature.
Have I got a high fever?
Yes, 38.7. Do you have a headache, chest, or throat pain?
Yes, I have.
Now, let me have a look at you. I'd like to listen to your chest. Now breathe in, a deep breath. That's it. Cough, now again. I want to examine your throat, too. Open wide. Say, ah.
Ah.
Yes, it does look a bit sore. Let's take an X-ray of your chest and give you a few tests.
All right, thanks.
The test showed nothing wrong. A slight viral infection.
What shall I do today?
I'm giving you some antibiotics and aspirins. Take an aspirin when you've got a fever, and take 1 antibiotic capsule every 4 hours, and go home and rest in bed for 2 days. Drink plenty of water, then you'll feel better. Here's the prescription. Where are you feeling the pain?
I can't stand up. My stomach is killing me.
Can you put your hand where it hurts the most?
It hurts smack in the middle of my gut.
Did this just come on suddenly?
I felt okay until an hour or so ago, and then I just doubled over.
Have you exercised strenuously or played sports recently?
No, and I don't usually get a lot of stomach aches.
We need to get you to an emergency room to see what the problem is.
I think that is the best way to figure out what is causing this. Thank you.
Good afternoon, Chloe. I'm Dr. Evans. What seems to be the problem?
Hi, Dr. Evans. Thanks for seeing me on such short notice. When I woke up this morning, I had a really sore throat and a really bad cough. I think I am coming down with the flu.
Ah, I see. Yes, you do sound rather croaky. Well, let's have a look, shall we? Could you please open your mouth and say ah?
Ah.
Good. Yes, your tonsils are a little swollen and red. How are your ears, blocked at all?
A little actually. My sinuses are a little blocked up as well. I really feel terrible.
Okay, Chloe. Can you please breathe in and out slowly for me while I listen to your chest? You really are all bunged up. You don't sound too good at all. Okay. I'm going to set you up with a bunch of.
Whoa. So many drugs. I hate swallowing pills. Am I able to go to work?
Absolutely not. You are highly contagious. You don't want to infect the rest of your coworkers, do you? I recommend staying in bed for at least 3 days and drinking plenty of fluids so yo.
Okay. Would you mind writing me a doctor's note for work? Otherwise they may think I am faking it.
Ha ha. Sure, not a problem. Here you are. Now off you go and away to bed. If you have any questions, just give me a call. Feel better soon and take care.
Thanks, Doc. Bye.
Good morning.
Good morning.
What's the problem?
I'm running a high fever and feeling terribly bad.
How long have you had that problem?
Since last night.
Then, you'd better go to the medical department. But first, you should fill in the registration card, and the registration fee is yuan.
Fine. But can you tell me how to get to the medical department, please?
Take the lift to the 3rd floor and then go along until you see the sign on your right.
Thanks a lot.
You're welcome. Excuse me, miss. What does the doctor say about me? When can I be discharged?
The doctor has examined your current situation. Since you are recovering so well, you will be discharged tomorrow.
Great, thanks. But how can I get discharged?
First, please get the bill at the doctor's office. Then pay it either with cash or by check. Even though you're discharged, you still need to take a rest at home. Don't hurry back to work until you have fully recovered.
Yes, I will. Thanks for your care. Hi. I was wondering if you have my test results in.
I didn't see anything out of the ordinary, but I want you to log onto our website for a printout of all of the details.
So, basically, I am okay?
If there were any major problems, I would always notify you by phone to come in.
What will I learn when I see the results on the website?
A description of each test is given on the site.
What will the numbers tell me?
The website will give you a normal range and then tell you what your results are.
Are all of my test results on that site?
Your entire test history is on the site. You can compare your results from other years.
Following our free educational materials, you learn English in a great way with ease and efficiency.